The biggest team, the biggest coverage. This is Fox 31 Morning News.
Hey, welcome back to 11:40 on your Monday morning. Taking a live look at the Mile High City. Again, 64 degrees right now.
It is beautiful. Inside from this view and then outside as well, you know.
Can't wait to get out there. A bit breezy today, but Greg will have that forecast in a few. Last week, one of basketball's brightest young stars, you see here, Victor Wembanyama, well, he was diagnosed with a blood clot, also known as deep vein thrombosis.
Yeah, and while the news surprised many, the Spurs star, a healthy 21-year-old, knew at 11 it could happen to you.
That's right.
Yeah, health experts using this as a chance to stress life-threatening issues can occur no matter age or health. Dr. Alex Leung, a vascular surgeon at HCA HealthONE Rose, joining us now. Thanks for joining us this morning. You know, I mean, this is a surprise, but there are things to look out for. We're just talking about what are the signs that this could happen to a regular person.
Yeah, so the signs of DVT, usually the most common things are either pain or swelling in a limb, or you can even have discoloration, particularly blue discoloration.
Yeah, we were just saying, I mean, he played in the All-Star game. And again, this is a professional athlete that's in phenomenal shape. This could happen to anybody. But I don't think he showed any signs, at least that we knew of, you know, that he was injured. Or let's talk about what deep vein DVT, deep vein thrombosis is. Is it okay to refer to it as a blood clot?
Yeah, so DVT is just a blood clot in one of the veins. They can occur in any vein in your body. More typically, we see them in the lower extremity vein, so a vein in your leg. And that's, you know, way more common than what we're seeing in this athlete where he has an upper extremity DVT. However, the blood clots in the upper extremity are more common when you see these real intense athletes. There's something called venous thoracic outlet syndrome. So it's a subset of, or it's an anatomic problem that would make him more likely to get a blood clot in his upper extremity, and that's due to repetitive movement in his upper extremity.
Can you talk about the complications that could possibly happen and when someone who suspects they have this, when they should go see their doctor?
Yeah, so certainly if you have leg pain or swelling that comes on suddenly, or especially if you've just been on a long flight or sick, that would be something that should prompt evaluation. The reason we have to manage these so carefully and quickly is that these clots can travel to your lungs, and that can be deadly.
That was a question I was going to ask. And for people at home watching, yes, this just happened with Wemby in the NBA, but Deion Sanders, the head coach of the Buffaloes, has dealt with blood clots before, and he's had issues with his leg. Chris Bosh, another professional basketball player. So this is not uncommon. It's not rare, and it's not just athletes that we're talking about, professional athletes here. Why is it so dangerous? What does a blood clot do that, you know, forces now Wemby has to sit out for 6 months? Why is this so dangerous for not only athletes but everyone?
Mostly just the, you know, traveling to the lungs. So when the blood clot travels to the lungs, that can deprive your body of oxygen. It can cause your heart to stop. Those are the main things we need to prevent. So we can prevent it using blood thinners. So we start any patient with these blood clots on blood thinners. There are newer procedures we can do now to extract the clot.
So just in general, if someone hasn't shown any symptoms, what are lifestyle changes or things that you can do to prevent this from happening?
The big thing is to stay active, actually. So, you know, you hear about people developing these clots after a long trip. So if you're on a long flight, get up and move around while you're on the flight when it's safe to do so, or kind of moving your legs around. Those are things that are going to decrease your risk of forming the clot, because as the blood kind of just pools in your legs on long trips, that's going to cause them to clot or be more likely to clot.
You do hear that a lot, you know, when you're on a long flight, get up, walk around, but this is real information that's why you should be doing that.
Absolutely. And we've heard, I know, you know, you don't know that case specifically, but for Wemby's case, they say the reason he can't play possibly even into next season is because if you're on these blood thinners, you're not really supposed to play professional sports when you're on blood thinners like that. Is that right?
Right. Certainly, you know, if you have a trauma and on a blood thinner, you're going to be more at risk for bleeding on the blood thinner, which could include your brain or other parts of your body. Now, the other thing is that in these athletes that develop clots in their upper extremity, it can be an anatomic problem, meaning they need to do surgery to remove a rib, and that requires more recovery than blood clot in the leg.
It's a very serious situation. Again, it's not just professional athletes. Everyone needs to be careful and watch out for this. All right, that's Dr. Leung with HCA HealthONE Rose. Thank you for joining us this morning.
Thank you for having me.
Yeah, all good reminders for people out there.
Absolutely.